Vertigo. A lot of medical complexity as well, but basically, he talked quite a bit about the lack of a cookie cutter approach and how that was able to help him. So finding a specific solution for the problem. So why was he having the problem that he was having? And because of that, now he's getting back to horseback riding. He's getting back to work. He's able to drive again after having horrible vertigo and dizziness problems. So really being able to get back to life again. Our client, Imana, very similar problem, was having severe vertigo for about 6 months, was getting treated about 16 times by another vestibular therapist. Didn't solve the problem, and so within a couple weeks, life was back to normal. Once we figured out why she had vertigo and treated her, and now she's 100% back to normal, going hiking, doing yoga. I gave her yoga exercises, told her to go through a yoga routine so her head would be moving a lot, right? Again, these are individualized solutions. How do we get her back to yoga? Just because you treat somebody for vertigo doesn't mean they're going to go back to the things that they used to do, because every time if your head moved, when you bend down or you look up or you roll over in bed, and if that happens to you for 6 months, you're probably not going to want to do that anymore. I had one client who was suffering for 35 years with vertigo. One treatment session and it was gone after 35 years. She's had vertigo as long as I've been alive. It's not always one time, but you get the point. And so sometimes it can take more than that, but it's simple. There's a simple solution. It's completely treatable.
And Imana can now sleep any way she wants to.
Right. So we have a 74-year-old client who fell, ended up in the hospital, and now she's getting back to basically being able to take care of herself again after coming out of the hospital. She talked about the team collaboration that we take with our practice, and then the way we communicate with our doctors. So that's very important. So making sure that the healthcare providers are talking amongst each other. So this 77-year-old male in Rowlett, he had a balance problem, but he had a bad experience after a hip replacement. Basically, again, why was he having a balance problem? Where it was a combination of that vestibular strength that was no longer there, a back problem, a leg tightness problem that was pulling him forward, a hip weakness problem. All these different things together, you cannot throw a cookie cutter approach at that. And actually, I would say he's more normal for the population. Because how many of us, or how many people over the age of 80 have one cause to a balance problem? It's probably a combination of the arthritis in the knee, the fact that they have a history of vertigo. It's also the hip weakness that they also have. It's also the cataracts that they have going on. It's all these things together. It's a bunch of stuff.